Welcome back. Dr. Basha here, Part 6, Thyroid Series. How many times in your traditional medical setting does your doctor call you in and say, we're going to devote an entire session to your diet because it's so important when we're doing thyroid assessment. As a matter of fact, I'm going to have my nurse practitioner email you a form. I want to see what you're eating and drinking for 1 week. And afterwards, we can circle and highlight the foods that are exacerbating your thyroid problems. The preceding was a fictional story because it does not happen in a traditional medical setting. At Basha Health, we will look at your diet. We want to see what you're eating for 7 days. You fill that out, we'll schedule a session, we'll talk about it. Certain foods exacerbate thyroid problems. Certain foods ameliorate thyroid problems. But it is essential to make a differential diagnosis. Do you have hypothyroidism? Do you have hyperthyroidism? You cannot approach this situation globally unless you have a skilled practitioner make that differential diagnosis. You may do yourself more harm than good. Let's say you go to Whole Foods or Sprouts here locally in San Diego, and you go to the nutrition section and you say, I need something good for thyroid, and the person picks up prescriptions for natural healing, which is probably now 700 pages, by an RN. It's a good book. And they say thyroid, iodine. They say, hey, here's some kelp supplements. Eat some nori seaweed. Folks, please don't do that. If you have autoimmune thyroid as opposed to hypothyroid, and you intake excessive amounts of iodine and salt, you could actually fire the autoimmune response up and hasten the destruction of the thyroid tissue. Stay tuned for Part 7.